All right. Hello, everybody. Thanks for bearing with us a couple minutes. We had some minor technical difficulties, but thanks for hopping on. Everyone is muted, so if you try shouting questions at me, which I know a lot of you like to do, I won't be able to hear them. Please use the question box on the side panel of the webinar, and we will get started in just a couple minutes.
Oh, I got it. What?
All right, everybody. Thank you for joining us today. I'm Samir Tanna. I'm Director of Public Policy and Community Engagement here at Illinois Action for Children. Again, we're very happy that you can join us today for our State Budget and Policy Priorities webinar. It's been a while since we spoke, so we have a lot to get through. And we hope to get this done in less than an hour. Everyone is muted again, so you can't just yell out questions. So if you can, please use the question tab or chat tab to ask those questions, and we will answer them all together at the end. So without further ado, we'll get started. First, we'll go through the agenda for today's meeting. So first thing, we want to go over some things that have happened since we last had a webinar, which was probably 6 months ago. And, a lot of things have even happened since our since our fall into action meetings. So we have a lot to go over. Then our new Vice President of Policy and Advocacy, Teresa Ramos, will talk about the Governor's Early Childhood Funding Commission. Then I'll talk about our budget priorities. And then we'll have Maria Eslin, Senior Policy Associate, talk about our policy priorities for this legislative session. We'll go over our advocacy opportunities, your advocacy opportunities over the next few months. And then we'll have a Q&A session. We can answer your questions. So we will get started from there. So first off, want to go over a few of the good things that happened since we've last been together. As of January, this month, there was the DHS announced across-the-board rate increase of 5% to all providers in all regions. This is a huge victory. It's only the second rate increase in the last 10 years for many of you, and we are very happy to have helped make this happen. There's also a large parity increase, an additional 15% to all Group 2 centers, which are the Group 2 region, are more rural regions of the state, but it's still hard to pay staff and retain staff properly and to get families to come to your child care center. So we're happy that there was an additional rate increase for those regions. In October 2019, I think you all saw, we had an income eligibility increase, our first substantial increase for a long time, up to 200% of the federal poverty level. I think the last time it was at 200% was in 2011. So more families are now eligible for childcare, and hopefully, and because of that, we actually have more families participating in childcare, and we'll show you a chart later on that. Also, for the first time in that I can remember in Illinois, we have a new out eligibility level. So if families do receive raises, change jobs, add some income over time, and they are now earning more than the initial eligibility at 200% of the federal poverty level, they actually have some room here to redetermine and to be to stay on the program even though they received those raises. So that new level is 225% of the federal poverty level. So while it's not a 100% fix to this cliff that we always talk about, it is a step in the right direction. We're very happy to have that happen. And then also there's, after your eligibility is over, so let's say you've been in the program for 2 or 3 years, you're no longer eligible for childcare based on your income or your work status, there is a 3-month graduated phase out, so that you can stay on, and families do have that ability to find other arrangements for their children over that 3-month period. Next, we copays were not increased on July 1st as they normally are, or they normally have been in recent years. The DHS also reduced the copays for families at the top end of the income scale from just over 10%, and in some cases up to 11%, down to 9% of a family's income. Their stated goal is to eventually reduce that top end copays down to 7% of a family's income, making childcare more affordable, but also making it easier for providers and educators to provide care for those families because there's less cost sharing and a little bit more money coming from the state. And like I said, copays did not increase for the rest of families, again, which they normally do, so that's good. And then finally, actually there were a couple other changes. At that time, there was an extension of eligibility for children who turn 13. They can actually stay on CCAP for longer in their after-school programs. And there was a couple other things I just don't have right in front of me right now. But these are some really great policy changes that DHS was able to do. And part of it was because I think it was a second or third year in a row, we have a full budget. We have a budget at the beginning of the year. There's more stability in the actual administration of the program, and we're seeing some good things happen. And then finally, the last thing I want to mention is the federal budget, the final budget deal that came through in December increased CCDF federal child care funding by $550 million, and Illinois' portion of that is $18.6 million. So beginning this current fiscal year, we're receiving $18.6 million more from the feds for childcare, and that should happen going forward. So not only are we getting that $75 million that we received 2 years ago continuously, we're also receiving this $18.6 million. So we are receiving, over $90 million more dollars from the feds than we were just a few years ago. And that is great and is pointing us all in the right direction. And so hopefully we can build on this going forward. So next, we want to talk about the Illinois Commission on Equitable Early Childhood Education and Care Funding, and our not so new anymore, Vice President of Policy and Advocacy, is here to talk about that. So I'd like to welcome Teresa to the phone.
Thanks. I think we can even just go straight to the next slide. I'll try to be brief, and if there are questions, we can hit up the question box. But hopefully everybody's heard by now that in December this commission was launched, really with the task of identifying a new and improved funding strategy for childcare and early education. You'll see the charge here. I think what I'd like to just go over is I'll go over some of these working groups and what I think they're going to be tasked with, and then the timeline for this work. And so these 4 work groups, funding adequacy, funding mechanisms, inclusion, management oversight, were just tasked 2 weeks or so ago. They are made up of committee members. I think there's about 26 or 28 formal commission members, and they are folks. You have somebody from Action, somebody from the OUNCE. You have leaders of state agencies like Carmen Ayala, the leader of ISB, the State Board of Education, and Grace Ho. And then you have legislators and providers and some school district leaders who are sitting on that commission. And they have been broken into these 4 groups. And then 2 to 5 kind of external partners have been put on each of these groups. And so the first group, funding adequacy, is tasked with identifying what are all of the costs that go into providing excellent or high quality childcare and early learning. And that literally means, I think we've talked to some of you about cost factors, like what does competitive compensation cost, including benefits? What does it cost to provide food? What does it cost to provide updated space? What are the costs for, renting or leasing or owning? All of those costs will be analyzed by this group, and they will come up with a number. So some will be what Teresa Hawley, who's leading this work through the governor's office. Some will be costs that you already see in your programs, but there is an opportunity here to say, well, this isn't a covered cost, but it should be. So the things that we've been hearing, for example, might be transportation or additional supports for students with special needs. So there's a lot that could happen in that work group. That work group will make some general recommendations, just like the rest of these work groups, and I'll come back to the timeline on that in a second. The funding mechanisms work group is getting together to decide how should we distribute the dollars. So once we have this total dollar amount and we can agree on, like, we're going to add X number of millions each year, what's the best way to get those dollars out? I think super important, because in my 10 months here, I've heard so much from providers about how the RFP process is not fair. We've done a few research analyses on why, like, an RFP process doesn't work. It might not be the most equitable strategy. So they will mull over and make a recommendation for, should there be some other way to fund programs outside of maybe a competitive RFP process. Then the inclusion group, which really will feed into all of these groups, is going to be discussing and making recommendations on how to best support students with special needs. And that could hit on both the delivery of the funding and the total cost of funding adequacy. I will say, just as a side note, the funding adequacy group is not only tasked with, like, what does it cost at a local provider, but then what are the types of supports the state needs to factor in and build out to support providers as they move potentially into licensing and from licensing beyond. Anyway, so inclusion will make recommendations for all the committees, and then the management and oversight will really be looking to make recommendations on, are there ways to streamline and align existing systems and program requirements, so that way it's not so confusing and there's not so many differences between the existing program requirements that come from each funding stream, like CCAP or PFA, et cetera. And I anticipate they will also make some recommendations around accountability, meaning that if we're going to put, I think, much more money into the childcare and early education system, really getting providers more money that covers the true cost of care. How are we going to know, how will the state know that those dollars are being used to support student learning? And so there will be some trade-offs, I think, and management oversight will make some recommendations. Now, these working groups are like at a fever pitch in terms of speed. They are meeting starting, I think, this week, and they will be done meeting by June and have kind of their high-level recommendations. And so there's opportunities both now to influence these working groups, but then from June till October, their recommendations will be up for discussion at these public commission meetings that will happen monthly, and as soon as I think the weather gets a little bit better, across the state. So there will be lots of time to submit recommendations and feedback to these work groups, and then starting in October through December will be the kind of final write-up phase of this report, which will go in to the governor's office as recommendations in January, and then we're looking at January of next year to really move something through the General Assembly. This is good timing for us. We at Action for Children are working on the fair tax. I'm sure Samir will say more about that. But looking at like what's the revenue that we're going to need to really fund the system that way that we think it needs to be funded. And so to support all of this work, to make sure that providers and parents are really being represented, we have started to work on building a coalition to support kind of our interest in advancing the system. And I would say in about 2 weeks, everyone who's connected with us and on our mailing list will get an email from our system that says, if you're interested in having in joining as an individual and joining as part of your provider or joining as part of your association, our coalition, here are the things that we want to see come out of this commission. Here's what we expect from coalition partners. And we will soon launch kind of regular check-ins to share with you what's happening on the commission and to get your feedback on the recommendations that we're seeing. So that's it in a nutshell. I'm happy to take any questions down the line. Thanks, Amir.
All right. Thank you, Teresa, for that update. There's a lot going on, guys, and we haven't even got to the bulk of it. So we're going to go through I'm going to walk you through our budget priorities for this coming legislative session, which began this week. So first, a little bit of a timeline here. The governor is going to have his budget address on February 19th, and in the past, we've tried to come up with our budget priorities around what the governor is going to talk about. But this year, we want to really try to influence the governor's budget address and his proposed budget to make sure that early childhood is a priority. So we want to make sure that we're sharing with you as soon as we can, which is today, what we're looking at coming up for this legislative session, and we hope that it'll help you do your advocacy to the governor's office, which we'll talk about later, how you can help influence the process to make sure that the governor is prioritizing early childhood in his budget address. So we will walk you through our asks right now. The first thing we're going to ask for is a $100 million increase for the Childcare Assistance Program. As I mentioned earlier, we have had a bunch of changes to the program, increasing eligibility, increasing rates. One thing I forgot to mention was the expanding of the 80% attendance rule to licensed exempt providers. We have a higher caseload than we had a year ago, and even the year before that. We finally are right up against 130,000 kids, which, while isn't as high as it used to be, it's continually growing over time. So we need to make sure that there's enough money in the budget to cover an expanding caseload. The next thing we want to make sure that there is money for in the budget is to build upon some of these more recent family-friendly policies like 12-month eligibility and lowering copays to make sure that families can stay on the program. So of course, we're going to continue to look at strategies on how to reduce copays for families to keep them on the program, whether that means, and allowing families to access higher quality care. So whether it's reducing copays across the board, eliminating copays for those in the lowest income brackets, eliminating copays for families that are accessing silver and gold rated programs, or accessing Head Start or PFA or PI programs. We want to make sure that copays are not a barrier for families accessing high quality care. So we will be working on those strategies, and we need to have money in the budget to make sure that we can do that appropriately. And lastly, we need to address demands on compensation. Minimum wage is going up. It just went up in January. It's going to go up in July. It's going to go up in next January, and then every year after that. It's happening, and we don't want to talk about the early childhood workforce as a minimum wage workforce. The reality is that many providers many educators make around minimum wage, unfortunately. But we also want to make sure that when these minimum wage increases go through, that those who are earning above minimum wage, or even well above minimum wage, get parity increases. If minimum wage goes up $1 an hour, that those people working well above minimum wage can also be provided a wage increase as well, and rate increases go a long way to help to make that happen. So in our budget, there's already likely contractual increases for SEIU's contract. We want to make sure that rate increases are potentially even higher than that. So we have built in our model a 5% rate increase for all providers once in July, and then another 5% increase in January of 2021. And while that increase may not go across the board to everyone in every group size and every group or age range, we're looking at the idea of a pool of that much money to ensure that we are targeting rate increases to where the most demand and need is. So whether it's infant and toddler care, or whether it's a higher increase for those in the Accelerate program, we have to figure out better strategies to make sure that children can access high quality care and that providers can provide that. And rate increases and compensation increases go hand in hand with that. So we are working on trying to be more creative and have the money to allow us to be more creative. So I think it's going to be a really exciting year on that front, and we're going to need input from all of you to make this happen. So just to show you what the current caseload looks like on the next slide, you can see we always talk about this June 2015 before the eligibility restrictions were put into effect. We were nearly 160,000 kids on childcare. This has been our average over the previous few years before that. And you can see we're starting moving back in the right direction. 12-month eligibility happened in October of 2018. You can see the caseload starting to come up through September. And then, of course, what happened when families who were on the program had to redetermine, a bunch of them fell off. And it's unfortunate, and we need to work behind the scenes. It's not really a budget ask, but we need to work behind the scenes on how to make the application redeterminations more family friendly, so that families can stay on the program and providers can continue caring for them. But you can see on average, our caseload is up year on year, and we are hoping that will expand further into the next couple fiscal years. Our next budget ask is around the Early Childhood Block Grant, which is in the State Board of Education budget. As many of you know, the Early Childhood Block Grant funds Preschool for All, which is high quality early education services for children 3 to 5, and Prevention Initiatives, which is center-based and home visiting services for children birth to age 3. There's a three-pronged approach here to why we need $150 million. First, we need to continue investments into infant and toddlers. Illinois is one of the few states that has a set aside for children birth to 3. We spend statutorily now 25% of all new appropriations on that. We know it's extremely important. Most of those kids are in, or many of those kids are in, center-based, community-based programs and home visiting, and we need to make sure that we continue to invest in those kids and those programs. If you're seeing a theme here, you'll see it right now, compensation parity for early childhood educators, especially in community-based programs. They are paid much less than their counterparts in the K-12 system, whether it's K-12 or whether it's early childhood programs in schools. Those working community-based settings are paid much less. They work more hours. They have the same, many oftentimes have the same educational attainment, have the same training requirements, are the same teachers in every way except for where they work and how they get paid. And we need to make sure that as we're expanding access for children, that we're also making sure that the educators are compensated in an appropriate way, so there's not turnover in early childhood programs, in community-based settings, and that children do have that continuity of care. The compensation of the educator goes hand in hand with the quality of the services for the children. So we need to make sure that everybody's compensated appropriately. And then, of course, tying into that is we need to make investments in their current block grant programs. Like, yes, we need to expand the number of children eligible and that have access to high-quality early childhood programs. We also need to make sure that those children who are in current programs are getting the high-quality service that they need, whether that's expanding from having more comprehensive services available on site, either through mental health consultants, whether it's more family engagement services, other health services. Children don't just need education, they're a whole child. They need a lot of support, especially if they're eligible for services. And we need to make sure that when they're in programs and we have them, that we're providing them with those services. So $150 million will go a long way to starting to build this system the way we need it to be built. Next, compared to the other two budget asks, these next two aren't as large, but we are asking for a $25 million increase to early intervention services. These are therapies for children who are identified with the delay ages 0 to 3. The first thing we need to do is meet demand for services. A few years ago when the previous governor wanted to cut early intervention, we made a push with early childhood providers to make sure that early intervention was not cut, and we're seeing demand for services increase from then. We've also have an eligibility change, which allows children who've been exposed to lead to receive early intervention services, and unfortunately, that will increase the caseload, and we need to make sure that there's enough money for that. EI providers got their first rate increase for nearly a decade, starting this fiscal year. We need to continue that reimbursement rate for early intervention providers continues and is increased again. Increasing compensation for providers, we think will increase the number of providers there are, and hopefully help them reach more children. And then finally, we need to invest in infrastructure improvements. I mean, this is really across the board, but the EI data system is extremely lacking in its ability to support families and providers, and we need to make sure that these infrastructure improvements are made. So that's how we get to $25 million there. And lastly, we need to increase DHS home visiting programs by $4 million. This was the hardest hit early childhood program besides Childcare during the budget crisis. It was not funded immediately, even though it did get full funding. It always came at the end of the fiscal year. So home visiting providers weren't actually providing services because they were not getting paid. They did not have an appropriation. We saw a large drop in the caseload over the last few years, and we're hoping to bring that back. So by adding $4 million in the budget, we can expand home visiting to more families. We can also increase home visitor wages. They haven't received a raise in a long time, and we need to make sure that those home visiting providers do actually want to continue doing that service. So we need another. That's about a 25% increase to the total home visiting budget. And as an aside, which I should have mentioned earlier, the governor announced that they intend to expand universal home visiting services for all eligible families and to get to universal by 2025. Increasing this home visiting budget is one way to start us on that path. The other way is part of that $150 million increase for the State Board of Education also has home visiting services in there. So if we want to meet the governor's goal, if the governor wants to meet his goal of having universal access to home visiting, we're going to need to start throwing some money into the budget everywhere to make it happen. And this is the first step along that way. All right. And then I think the last slide here is just to in some ways memorialize what we're asking for and to show you some historical spending and appropriations on the early childhood programs. You can see that, over the last few years since we've actually had full and complete budgets from the state, we've been making progress. We are serving more children. I think the question is now, as we serve more children, we need to make sure that we're serving all children at a high quality way to actually make a difference in the child's outcomes going forward. So thank you again for letting me speak here, and I will take questions at the end, so please put them into the question box. And I'm going to turn it over to Maria to talk about our legislative priorities this session.
Thanks, Samir. Hi, everyone. This is Maria Esplin, Senior Policy Associate, and I'm going to, like Samir said, just dive into what our policy priorities are for this coming legislative session and the year ahead. So first up, one of our biggest priorities is to, support and promote strategies that attract and retain a diverse and effective early childhood workforce. As Samir noted earlier, the early childhood workforce, which is made up of early care and education providers and teachers, early intervention professionals, home visitors, and many others, they continue to face inadequate compensation, as well as, what the impact of those low wages means for workforce trends and program practices and our level of quality in programs, as well as communities and the children and families served by these programs. So we will be working with our advocacy partners to ask the General Assembly this year to pass a resolution urging the Illinois Department of Human Services and the Illinois State Board of Education to implement policies and strategies that ensure funding is directed toward improving compensation. What we will be advocating for is compensation that's competitive with other industries, and it better reflects the qualifications and experience and education levels of this workforce. So once we have a resolution number, once it's introduced, we will share that back out with everyone so you can follow along with how it moves through the General Assembly and call your legislators and advocate for moving that resolution forward. And we've got a couple other strategies that we are prioritizing when it comes to workforce issues, and they kind of center on higher education. And the first is to allow for alternative, innovative pathways to higher education coursework and degrees. Current and aspiring early childhood professionals, many of whom are balancing family responsibilities, they face financial, geographic, cultural barriers, and many others that prevent them from accessing traditional degree pathways. So we recommend identifying and investing in pathway models that provide support to meet the various needs of, adult learners, first-generation college students, student parents, career changers, and other non-traditional students. And one of the ways that we're thinking about this is potentially piloting the authorization of community colleges to confer applied baccalaureate degrees in early childhood. Community colleges are uniquely situated to meet the needs of non-traditional students, and their role in the community means access for a more diverse pool of early childhood BA holders. This will be something that we continue to consider and talk with stakeholders about in the near future. And we also know that among and across 2- and 4-year programs, it's not just 2 to 4-year programs, but also those transferring between 2-year programs or between 4-year programs. The providers experience challenges in transferring coursework and credit hours and in making them count towards count towards whatever program they're going to in this new school. And it makes it difficult to kind of achieve that final degree. And this is something we want to engage in and work with our partners on, probably more administratively, but work to address this big issue for providers. We also, a priority that we have is to increase investments in tuition assistance and other financial supports. Taking on the upfront costs associated with seeking a degree or a credential is a significant burden for a workforce, especially one that is undercompensated like this workforce. And we recommend expanding financial supports, including MAP grants, monetary award program, those grants, as well as some of those financial supports that target teachers, like Gateways to Opportunity scholarships for early childhood teachers and Minority Teachers of Illinois scholarships and things like that. And then kind of, similar to the tuition and financial supports that we just talked about, we'll be working to support all student parents in accessing childcare supports that are critical to their success in school. Student parents not only face the same, those financial challenges that I mentioned earlier, but they also face additional barriers, like including arranging and paying for childcare and balancing that academic and extracurricular activities with caring for their children, with having to pick children up from school, from care, all those things. And, there's been research that shows that only approximately 1/3 of colleges of the colleges that were reviewed, advertise that students could access the federal dependent care allowance and things like child care assistance. And recently there was legislation passed here in Illinois that required colleges to notify MAP eligible students that they could be eligible for SNAP or food stamps to help them pay for healthy food that they need while they're in school. And this year we're going to be working with some partners on legislation that would be similar in terms of notifying those students that they could be eligible for child care assistance and the federal dependent care allowance supports, just because we know a huge barrier to even to accessing these types of supports is just knowing that they exist and knowing that you may be eligible while you are in school. So again, when the bill is introduced and we have a bill number to share with you, we will do that through our alerts and our newsletters and make sure that you guys have the opportunity to weigh in and advocate for this to move forward. And lastly, we are prioritizing ensuring that childcare licensing standards prepare providers and the department to be efficient and successful in their work. The initial priority action for children, we'll be recommending cleaning up the statute section in the Child Care Act that defines exemptions from licensure. After years of amendments, several sections within the Child Care Act are kind of in need of reorganization or clarification and other changes they've been added to, and the flow doesn't really, it's not necessarily intuitive, and so it can be kind of unclear who is exempt from licensure, what the requirements are for exemption or for licensure, who really qualifies for that exemption, and we want to make sure that the right people are taking advantage of exemptions, and everyone is clear about what they need to do in order to be exempt or to be licensed. So that's something we will be working on in the coming year. And like I said, if there's a bill number, we will be sharing it out to everyone, and we want to do this with the input from the department and providers and other partners. So now that we talked about, our high-level legislative agenda for the coming year, we hope that you're excited about some of these things and excited about the budget asks that Samir went over, and as well as the work of the funding commission that Teresa talked about. And so we want to talk about some ways that you can get involved and ways that you can engage in advocacy soon. So the first one upcoming, February 4th, we are having a budget day or a budget call-in day, asking folks to call the governor's office before he delivers his budget address on February 19th. We want to make sure that he hears from the early childhood stakeholders and hears what our budget asks are for the year, as Samir laid out really well, all these things that we know we need to do for children and families and for providers, we'll need additional investments. And so we want to make sure that we get a lot of calls into the governor on February 4th, and folks make sure that we lay out those priorities for the coming year. So we've sent out, save the dates earlier this week, but watch out for additional alerts with talking points, and on the day of, there will be talking points in your inbox for those who get our alerts and newsletters that talk about the funding amounts that you can call and request from the governor, and what we can get with that money. And a couple other opportunities, Spring into Action, our annual conference here at Illinois Action for Children, that will be held April 28th and 29th of 2020 down in Springfield. It's a great opportunity to join other early childhood professionals to learn about the important policy issues facing the field, have an opportunity to network, and then also on the second day, it's Early Childhood Advocacy Day, where we partner with our partners, our advocacy partners across the field, the Ounce of Prevention Fund, Latino Policy Forum, and others, to bring those who care about early childhood, providers, families, everyone who cares about the earliest years of children's lives, down to Springfield, and we kind of swarm the Capitol, and we go talk to our legislators and make our voices heard about what we need to do for children and families. That will be the second day of Spring into Action, April 29th. Spring into Action, the save the dates have gone out, but the registration is not quite open yet, so we will be sending out alerts as soon as registration is open, and we hope you all will join us for those days. We also, as Teresa mentioned, there's opportunities to stay not only up to date, but also engaged in the work of the Governor's Early Childhood Funding Commission. So in the coming weeks, we'll be sending out communication on, more info on how to stay involved in the Funding Commission work, but also if you want to sign up to be a part of this broader coalition that we'll be working with to advance our priorities in terms of the Funding Commission work. Also, just in general, look out for more alerts. As the legislative session goes on, it started this week and will go through the end of May. And as these priorities you mentioned, and as budget bills pop up, we will be sending out alerts all the time to let you guys know where things are in the legislative process and how you can advocate for these things, these investments in early childhood. We'll have alerts to call your legislator, to call the governor, to file witness slips in support of something that's great for early childhood, or just to make sure that we're all making our voices heard throughout the entire legislative process. So those are the big advocacy opportunities coming up now. But last thing before I move to questions, I do want to just note that the State Board of Education, the RFP for the Early Childhood Block Grant is open right now. So we will be sending out more information, and I know a lot of our partners have as well, but if you check out ISB's website, you can find out more information on the RFP that is currently open. And with that, I'm happy to take questions about the policy priorities, and I'm going to turn it over to Samir for questions.
Yes, hello everybody. So we have a few questions here, and some of you will receive individual answers if it's a specific question about your program. But I'm going to go through some of the broader questions. One question here is around rate increases and healthcare for childcare providers. I think one thing to tie, so the rate increases that are coming at this point, I don't see how it's gonna make a meaningful difference on whether you as a director or owner can provide healthcare depending on what your model is. But can definitely go to compensation. But what the Funding Commission is trying to figure out is what is the cost of care for children, and that includes what your staff and directors and owners, what they need. So really, as Teresa said, if you want to stay engaged with the Funding Commission and be a part of it, we're happy to include you in some of that process and keep you up to date. And these are the things we're looking for, like what are the actual costs that providers have, and we should be including everything that you want to provide to your staff. So make sure you let us know about that. Next is there's a question here around the silver and gold reimbursement rates. So just in general, the rate enhancements for accelerated programs are on your CCAP reimbursement rate. So if you do not receive CCAP, or the children who are not CCAP eligible in your program, you do not receive a rate enhancement for that. We are happy to look at more creative ways to fund quality and to ensure programs can get to, stay at, and move along the quality spectrum. So we would like to engage in that conversation as well, whether it's part of the Funding Commission or year-on-year budget advocacy. We are happy to do that as well. Let's see, there's a question here around comprehensive services in the PFA grants. We encourage, so I know that the RFP for new and expansion PFA programs is out. So if you want to add slots, there is an RFP out there for you. The governor's office is hoping to use, and ISB is hoping to use, the amount of money asked for as part of their ask at the end of the legislative session. So if you're thinking about applying, you should definitely apply. There will be ISB will hold a webinar on what to ask for and how to ask for it. And much like the last 2 years, you shouldn't be bound by an arbitrary $4,000 or $5,000 cost per child. You should really think about what services you're going to need to provide comprehensive services for the whole child, and ask for that amount in your RFP. But we will have more information on that RFP and how you should apply and where you can engage to figure out what's the best way to ask for money that way. So stay tuned for that. Let's see. There's a question here about why in this coming July and January, centers are not essentially guaranteed a rate increase. And so just, a brief thing on a little bit on collective bargaining. So the SEIU organizes home childcare providers, and in their contract that they have with the state, because they bargain directly with the state, they have contractual rate increases at certain times of year. So if they have contractual rate increases that will happen in July and January, what's happened in the past is, for the most part, except for 1 or 2 times since I've been here, DHS has given at least the same rate increase to centers. Whether that's the case or not going forward, we will certainly advocate on your behalf to make sure that happens. But when I was talking about a 5% rate increase that we have in our budget request, we want to make sure that there is a pool of dollars, whether that's a direct 5% again to every single age group reimbursement rate, or if it's a smaller rate increase to, let's say, PFA children, preschool children, but a higher than that percent increase to infants and toddlers, or if there's higher rate increases for having quality. That is what we're looking at. I'm not in all regions, in all areas of the state, the rates and what compensation can be given, how that works. It's different among regions and age groups. So we need to really unpack that and make sure that we're targeting rate increases to those areas, to those age ranges, to those regions of the state where it will make the most impact on compensation and quality of care. And let's see here. Somebody says a 5% rate increase is not enough. I agree. That's why we're advocating for a 5% rate increase in July and another one in January. So it will be over a 10% rate increase over the next year. So that is our goal. So when we say 5%, we're looking at rate increases happening every 6 months, or at least at the time that minimum wage goes up, so that providers can at least have some more money to account for that. There's a couple questions about the 13-year-old approval extensions. From my understanding is the new policy is the second a child turns 13, they don't automatically lose their CCAP eligibility. They can get paid either through the end of a school year or through the end of their determination. So you don't have to worry about in the middle of a school year, let's say in January, a child turns 13, you wouldn't lose, or that child wouldn't lose, and that family wouldn't lose childcare, even though they still need it when they're going for after school or out of school time before after school. So there's a couple questions on this, and I probably wasn't as clear as I should be. So we will send information out on that policy change with some of the documents from this webinar. I just want to make sure that you all have the right information. A question here on capital funds. So there will be capital funds available for early childhood programs. There's $100 million available that we were able to get appropriated. It is unclear at the moment when the RFP will come out. We're still working on the RFP, the eligibility, the potential match requirements. And so we are working on that now. Unfortunately, we're looking at potentially up to a year before that RFP is out. But again, we will keep you posted on that as it happens. And then a question here, which is, it's about CPS, but it's actually just about preschool for all in general. The ability to enroll families up to 400% of federal poverty. PFA as created the idea was to allow early childhood preschool services for all children. So there was a higher eligibility threshold on that. I understand it's hard to compete as a childcare provider with that. One of our goals is to not only make preschool for all available, more slots available to everybody, but also expanding the eligibility of childcare so that they match, and that parents don't have to make this choice based on money. They can make a choice based on what's best for their family, whether when they need care, can they do a school day? Do families need actually a full work day of care? Do they need two different places for care based on their work hours? So we're hoping that over time the Funding Commission can figure out a way to fund programs so that parents aren't making choices and that providers aren't competing based on funding stream, and that they're actually competing on what the child and family need. So we are working on that. Unfortunately, these are things that are not going to be solved in the next 4 months. And sorry, we just have a couple minutes left. And let's see, that was the majority of the questions. If there's anything we didn't answer, I can send, or one of us here can send an answer to you directly. But thank you so much, everybody, for being on this call. I hope it was informative. Don't forget a call-in day next Tuesday. You need to call the governor's office and tell him what he needs to include in his budget address, which again is a $100 million increase for childcare, $150 million increase for the Early Childhood Block Grant, $25 million for EI, and $4 million for home visiting, so that we can start and continue to make a difference for children and families in this state. So thank you again. Our emails are on here. You can email me or anybody on the team anytime you want. We'll also be sending out the documents. I think this PowerPoint's going to come in a link, and I'll get clarification on the 13-year-old CCAP policy and send that out as well. So again, thanks again for coming. Have a great day. Have a great weekend, and hopefully the governor's office is telling us to have you guys stop calling next Tuesday. Thank you.